Hi guys, Professor Novak here. Today I'm going to be talking a little bit about blood transfusion and setting that up. So remember, in the lab, we do not put our blood through the pump. We actually hang it by gravity. So a couple things you want to make sure, especially for simulation, you want to make sure that your patient has a consent to receive blood products. We also want to make sure that they have their necessary labs completed, such as their CBC, type and screen. We want to make sure that we have a baseline set of vitals, make sure we have a good working IV, all of those things. So before the blood actually comes up to the floor, we can prepare the tubing without the blood attached. And that's a good habit to get into because we're keeping that vein open and we're just kind of one step ahead before we have to verify that blood. So I'll put my gloves on here. So blood tubing is going to look similar to IV tubing, but a little bit different. The actual blood tubing has different ports and different drip chambers and spike sets and all of that, but you're gonna know it's blood tubing because it's typically in a bigger package. So you're gonna open up your package here, and let's just take a look at what we have. So go ahead and take all of your paper off here. And we're gonna take a look. So at the top of our tubing, we'll see that there are 2 spikes and 2 individual roller clamps. Then we have a filter in the middle. And then all the way to the bottom, we do have a roller clamp, and then we attach to our patient. So before we get to spiking anything, good rule of thumb is to close all of your clamps. You have a total of 3 clamps on the slide, so make sure you get all 3 of them closed. So roll those down. And then we're gonna roll this one down as well. I always want to spike and prime my set with saline. I don't want to do it with blood. I want to spike it and prime it with saline always, okay? The only compatible fluid with our blood tubing is going to be 0.9% normal saline. So we can't use LR, can't use anything with dextrose in it, okay? These bags have been spiked before, so if you are in the lab, make sure that you don't take a shower, so be very careful when you spike. So each one of these is going to go to a different product. One's gonna go to saline, one's gonna go to blood. I'm just gonna pick one for the saline. Take my cap off. I'm gonna spike my saline. Remember that my clamp is still closed, so when I put this up on the pole, I don't have to worry about it filling really fast, okay? So once I'm up on my pole, I'm gonna go ahead and open my saline line. And I'm gonna notice that it starts to drip into my chamber here. So this has a filter in it, so that way when we do spike the blood, it can catch any clots or any bad things that should not make it to the patient. So I wanna give this some good squeezes. And I want to make sure that I cover the entire filter with saline. So it's going to take a couple squeezes here. Just keep squeezing. Okay, once your filter is completely full, it should look something like this. Okay, now we need to get all of the air and everything else out of here. So my saline line is open, but I still need to prime the rest of my tubing because the distal end is not primed, okay? So we control everything that's below these 2 from the main roller clamp down here. So I'm gonna go ahead and open that up. And I'm gonna notice that my fluid is starting to come. I wanna make sure I get all my air bubbles out. And then I'm gonna close my main roller clamp. So at this point, my entire line is primed with saline. I am okay, or I am ready to hook this up to my patient, okay? I don't need the blood to be here at the bedside. I can just get this going with my patient. So in your little kit, you should have You should have a flush and some alcohol preps so that you can get that hooked up to your patient, okay? We're gonna say that's hooked up to the patient. And now our blood product has come to the floor. What you need to remember with this is once it arrives on the floor, you have 15 minutes to hang it. It cannot be sitting outside for more than 15 minutes or else it has to go to the blood bank. And the max infusion time up on this pole is gonna be 4 hours for this. So we wanna make sure that we get this unit of blood in the patient before the 4-hour time frame, okay? So what I'm gonna do now, I know I need to spike this on the other side, and I want you to think of the saline and the blood as a switch, okay? So I'm gonna close my roller clamp that's going to my patient, my main one, and I'm also going to close the roller clamp on my saline line. So make sure that that is off. My roller clamp for my bloodline is off because I haven't spiked anything yet, okay? So we're gonna keep it that way. Be careful with these bags. Remember, they've been spiked many times. I'm gonna spike this blood. I'm gonna hang this up on the pole. Remember, at this point, everything should be clamped. If you forgot to clamp your saline line, you're gonna start to see backflow. And you don't want your bloodline getting into your saline line and vice versa, okay? So all of my clamps are off at this point. What I wanna do now is open my bloodline clamp so that I can get the blood through, okay? When I open that, I'm gonna notice that nothing is really flowing. So I'm gonna wanna give myself a little bit of pressure and squeeze my drip chamber to get that blood flowing, okay? Once you're at this point, you have already verified the blood with another nurse. You already got your set of vitals. You have confirmed that your IV is good. You're good to go, okay? We wanna make sure that we're not spiking this before we confirm it with another nurse because you could be wasting a set if there's some sort of incompatibility or information that's not correct, okay? So once we verified everything, you as the nurse are going to calculate your drip rate. So remember, this is not going in a pump. So we will tell you, or we will give you a mLs per hour, and you will have to calculate drops per minute. And you will have to control that with your roller clamp, okay? This is tricky for students, so if you need to brush up on your math a little bit, there's some practice problems in Blackboard, or you can always reach out to me before you get this going, okay? Once this blood product infuses, we can shut the bloodline off and we can use saline for the rest of the way. And we do this a lot in real life because this tubing holds a lot of blood and we wanna make sure the patient gets every last drop. So we can actually open up that saline line and make sure we clear this line of any blood so that they get every last drop. And then we get our vital signs again and we take it all down and that's it. Remember, if you think your patient's having a transfusion reaction, stop it right away. New line with normal saline. We don't mess around with that. And all of your tubing goes to the blood bank. Just make sure you assess your patient, get their vitals, listen to their lungs, make sure they're not overloaded. And then we will redraw their labs in a couple hours to see if their levels have stabilized. And that's it. There you have it. If you have any questions, feel free to let me know and we'll see you in the lab.